Free State.
Now, the South African Health Products Regulatory Authority is considering up-scheduling products containing codeine. Medicines such as Acodol and Nurofen Plus are currently Schedule 2 medicines in the country, making them quite accessible over the counter. But there are now proposals that these products be scheduled so that there's better control exercised and the abuses become more difficult. Joining us now in studio is Acting Deputy Director of Regulatory Compliance at SAHPRA. His name is Mlungisi Bondo. Mlungisi, thanks very much for coming through. Always appreciate your time.
Thanks, Aya.
Let's start with the background, making sure, of course, that we're all on the same page. Help us understand this idea around scheduling. Yes. What's the difference between a Schedule 2 and Schedule 5 drug?
Thanks, Aya. Good morning to your viewers. Firstly, SAHPRA controls medicines in the country and monitors after they are registered. So a medicine will be given a schedule based on its safety and also its efficacy. In this case, the product we'll be talking about, it will be Schedule 2 if it's minimum quantities where safety can be controlled. And also it will be under Schedule 6 that will be highly controlled, that can only be accessed through healthcare professionals, being a doctor, prescribing to the patient or dispensing as well, or issuing a prescription into a pharmacy to give to the patients. The difference, as you are asking then, why sitting at Schedule 6 or sitting at Schedule 2, it will be at Schedule 6 is not accessible. Your doctor must have reasons to provide, and it's not given continuously for 8 months or 2 years. So at least it's controlled and it won't be subjected to abuse because the doctor will be monitoring the patient in that case. On Schedule 2 is based on access. Remember, now you don't have to go to your doctor. You can go to your pharmacy, and then your pharmacy can can dispense and record that they've given you that Schedule 2 medicine.
So then why have you gone about up-scheduling these particular drugs? I mean, I understand there's a whole context to this.
Let's use maybe your codeine and say why would we be interested in worrying about codeine.
Right.
It will be the abuse that is happening in SA or misuse in some instances. And then
what's the nature of that abuse? I mean, what are people doing? Or is it the people who are using, is it customers? Is it the people running pharmacies? Give us the nature of these abuses.
I'm happy you're asking the differences around the abuse. We've got different types. Some are age-related, where it will be your pure abuse and then leading to addiction. Like the stories we've heard of kids drinking your cough mixtures that have codeine, mixing with drinks or mixing with alcohol.
Wow.
Yes, and then that's your higher risk one because they are taking that to get high, and that's not the intention of that medicine.
They're taking it to get high?
Yes, and those medicines should be used for cough, and now people are not using it for the correct indication. They are using it for something else now, of which that becomes a problem. And now anything can happen with kids taking those things going to school.
Sure.
That's the risk we're sitting with currently. Now on the adults, it will be maybe you're doing it as well. You're wanting the products you've mentioned. You're tired from work, you just take it, your headache goes away, you sleep. But you end up wanting it every day. So people are not aware now that is now misuse, or abuse is no longer your normal treatment of a condition. So those are the different instances. However, the bigger one that is worrying is the one at schools now, where kids are using it as a fashionable thing to access codeine.
Wow.
And use it to get high. It's a cheaper version than all the illicit products you may know of because you'll be buying it less than 20 rands or 50 rands. So it's easy to access for them.
Wow, okay. I guess there's something to be said around even how they've discovered that this, can happen, but I guess it's a different conversation entirely. And this was obviously done after conducting some research into how these products are being used.
Yes.
When are the changes likely to kick in, and how is that going to affect, everyday customers who, are used to walking to a pharmacy and just grabbing whatever they need?
That's true. Remember now, it's two-phased. The other one will be access to medicines. We can't restrict you now to getting your pain tablets when you are sick. Now you must go to a doctor and you know you need your Acodol.
Yes.
And now you must pay the doctor and then get a prescription and still go to a pharmacy. The reasoning behind the putting it at Schedule 2 was those access reasons. However, controls should be there under Pharmacy Council, because pharmacies are controlled under Pharmacy Council. There should be controls. Pharmacists dispensing those Schedule 2 medicines must have records. And no, if you're coming again tomorrow or the same day again, the system should tell that you've taken that product twice the same day. I had the challenge maybe that we don't have your electronic sophisticated systems.
Yes, I was about to ask. I mean, are we expecting people to come in and sign up on like and also how do you then factor going to different pharmacies?
That's correct.
Yes. One, yeah.
Because now if we had your electronic systems monitoring those things, however, government Department of Health is looking at those with SAPRA of introducing systems. However, that may take some time. Hence, we're looking at your current measures. What can we do now? To protect the public not to abuse all these substances.
Yeah, so let's speak about that. I mean, what are some of the short-term interventions to curb this?
The short-term, currently we've been working with SAPS and tracking all. Remember, SAPRA has control over the data of who's selling the medicines, from manufacturing to the distribution points. So we have that data. It has been easy for us to access the data and see which doctors and pharmacists are ordering large quantities, and there have been arrests on those healthcare professionals where they've been, where we followed up and picked up that they were selling those medicines illegally. It's not even now a medical purpose. If you're going to buy a lot of quantity and then people just come over the counter and buy from a surgery, we know that's not the normal process.
Yes. Yeah. Now, I can imagine a lot of people are obviously going to be concerned if they are legitimate users of these products and they might be adversely affected. What's the message from SAPRA as you undertake this process to particularly those individuals?
On our side, especially on the kids' side, we'll urge parents to monitor situations of abnormal behaviors and try and get information where those products are sold. And then that's where SAPRA and SAPS come in and block those chains. Because in most cases, it will have been it's not illegal products. It's products that are registered, that are in the correct supply chain lines. And now we'll be able to track it back and deal with those distributors or healthcare professionals that are involved in those wrongdoings.
All right. Thank you very much for coming through. I do appreciate you explaining this to us. Mlungisi Wondo is the Acting Deputy Director of Regulatory Compliance at the South African Health Products Regulatory Authority. I do appreciate your insights.
Thank you.